Good afternoon, everyone, and welcome to today's Lunch and Learn. My name is Lynn Ladd, and I am the Manager of Programs and Member Experience with the Ottawa Board of Trade. We're here today with Scott Ashley from Get Ready, and he is going to tell us all about their new daily screening tool. This tool will help businesses be compliant with the need to screen their employees and also support them in the event that they ever need to do contact tracing. We chose to promote Get Ready because of the credibility of this organization, and I'm going to let Scott, President and CEO of Get Ready, introduce himself, and you'll learn why we are so pleased to be standing behind this program. So Scott, over to you.
Well, geez, Lynn, thanks for those kind words. It's great to be here. We're very, very happy to be working with you and be part of this. You know, it's interesting. Get Ready, we've been around for 12 years now, and we're a company with about 45 employees. We do a lot of emergency management, emergency operations centers for municipalities and governments, business continuity planning. But we've been doing pandemic planning for hospitals and organizations for many, many years now. And you know, it's interesting. Last year, it was literally about a year ago this time when the pandemic was formally announced, and people weren't sure exactly what to do. And I've said, look, hospitals have had an infection prevention and control program for, you know, almost 100 years, really since the Spanish flu. And now, due to COVID, every single workplace needs an IPAC program as well. And this is the trick, this is the challenge. You know, organizations don't have the expertise. We have a lot of critical care, public health people. Our medical director, Dr. Michael Christian, you know, has not only is he the head of the air ambulance in the UK, but he was the chief safety officer for the University Health Networks. He also has a master's in public health and led Canada's response to the cholera outbreak in Haiti and different things. And, you know, we've got a team full of police, fire, tactical, whatever, and we can build the programs that are specific to answer the questions of what am I supposed to do? And we see this all the time. Organizations, you know, they'll build or the government comes out with a big thing on vaccine or testing or in this case, screening and so on. And that's great. But what does the average person do? What does the average company? How do they take that high level information and turn it into operational readiness? And that's really what we spend our life doing is building, okay, that's what I need to do. So whether you're the CEO or security or facilities or a manager, director, you know, staff person, on-site, off-site, people always say the same thing. What am I supposed to do? What does that mean to me? And that's really how we try to operationalize this stuff. So the daily screening tool is part of our program. It's we've been using it with clients now since April of last year, and they love it. And you know, in Ontario, the law is now that companies have to do active screening. They have to figure out who was on site so that if and when there's an exposure or a positive outbreak, people know what to do. They have a record of who was here. So we have this group today. If next week I called in and said, hey, it's Scott here, listen, I just tested positive. Who was here last week when I was here? Now you'd have to go back in the records or take the time and try and figure it out. We see a lot of companies, you know, they're writing it out. They hand the next guy the same pen or they have a little station. People don't want to touch the same pen and pad and paper and notes. They don't want to share pens when they're writing down their name and their phone number and so on. And so what we did is put together the daily screening package. It's really simple. It's a daily screening tool. It includes a pre-drafted safety plan, which all businesses have to have by law. And we also provide infectious disease outbreak awareness training to all the managers within that company who sign up. And it's about a 30-minute online program. So it's a cloud-based tool. It's really simple to use. Basically, people come in and they click on a QR code. So they have their phone with them. They click on the code as an employee, as a customer, as a vendor, as a supplier, contractor, who's ever coming on site has to fill this in. And so we can have posters on the website or QR codes on the website or posters on the door or the entrance points. We're just talking to a couple golf courses right now, and they want to make sure that they can track their staff, but they also want to make sure they can track all the golfers or track all the golfers that are coming on. So they take the QR code, they click on it, it opens up the daily screening right on their phone, right on their smartphone. It literally takes them a minute. They put in their name, their affiliation, am I a staff, a contractor, a visitor, a customer, and then they can enter their phone number and email. They hit submit, and boom, all that information goes to a dashboard for the company, for the organization. So it's specific to each individual company. They have access to the information. If they want to go back and track by site or by department or by the type of role, again, a staff, a visitor, a customer, a contractor, whatever, they can then sort and filter and export a file. Public health has to start the contact tracing. They have to start notifying people so that we can get our hands around this thing before it becomes an outbreak. This is the critical piece. So with the press of a button, you can send to public health a list of all the people that were on site from the dates or the sites in question. So if you had to go back to last Monday up to today, you can just at a press of a button get that, and now they're instantly, public health is now reaching out and contacting people and advising them who needs to quarantine, who needs to stay at home, and so on. And it makes it so quickly. It's so quick and easy. It literally saves hundreds of hours. And so the safety plan is a package that we put together. You know, the government will say you should do this, or you should advise and should have a plan. Here are here's a generic version of all the procedures that you need for screening, for contacting people if they're sick, the communications. You know, whose job is it to call the WSIB? Whose job is it to call the Ministry of Labor and Public Health and so on? And these are all pre-drafted checklists that we put down, cleaning, the social distancing guidelines. So it's included in the package. And then the infectious disease outbreak, it's 30 minutes online. People love it. You know, the terminology, what is, you know, how do viruses spread? You know, the proper PPE. As an employer, if you give your staff protective equipment like masks, gloves, hand sanitizer, things like that, you have to teach them how to use that stuff. And we see people all the time, you know, they'll pull their mask down, they drink their coffee, they slide the mask back up. That's not safe. That's not proper protocols. And it's really important that people be shown how to do this correctly. So this online training includes those pieces so that a company can say that their staff are trained. These are other components you want to think about. You want to look at your distancing, physical distancing, what kind of barriers are needed, time, what PPE is required. This is called risk reduction. These are things that are done in hospitals every day. The paramedic, police, fire do it, and now businesses need to do it. What's the difference between that front-facing customer, you know, checkout cashier person who's very close to the customers versus someone who's maybe in a back room or whatever? What are the different PPE? What are the cleaning requirements? We look at the sites, we look at the floor plans, we determine the physical distancing. Where are people too close? Where can they sit together? What's going to be the flow? We've developed all the signage so that organizations can use our signs and they can put their own logo, their own colors and stuff on it. I think we have 18 different signs to help people understand how to navigate and move around. What are your policies and procedures? You know, as I always say, auditors like policies and staff like procedures. Just tell me what I'm supposed to do. Right? And so here's all the procedures for physical and social distancing, the PPE, exposures, cleaning and disinfecting. It's all part of the program. At the end, we certify your program because it's compliant with the IPAC requirements that hospitals follow. We're not making you a hospital, and we're not doing something nearly as complicated, but it's nice to know that what you've done is correct and it meets the Public Health Agency of Canada, FAC, or Public Health Ontario, and so on, and the different provinces across. We've done work with organizations across Canada, in the UK, in Europe, in the US, and so we make sure that everything is compliant to those local jurisdictions, you know, province-wide and so on. Our pricing schedule is you know, it's incredible. We charge $19.99 to a company for up to 10 managers. Of those 10 managers receive the training. That's unlimited use of customers, of staff to come in and fill out the daily report and do their screening. we include the safety plan for that as well. So it's an easy one, it's a no-brainer, and you're up and running. The onboarding takes us literally minutes. And lastly, I just wanted to show you this. This is brand new, it's exciting technology. It's called Poppy. This is the Canadian company. There's a US company as well. But it's pathogen sensing and protection network is basically what Poppy does. So what it does is it's put together by a very world-renowned team of experts who have taken pathogen and monitoring of these. So every time there's a little DNA or the RNA structure of viruses and bacteria, these things are floating around the air all the time. Poppy can track that, filter it in, and then doing daily or weekly reviews, determine what pathogens are actually in the building, on site, at the office, so that it helps you pick the trend and you can see what spaces are clear, which ones aren't. We provide a complete direction of what to do, the procedures. If you have a positive indication, what do you do? And we have a team that's available 24/7 to support companies through this. The big thing is, at the end of the day, that you know your program is working. A lot of this around pandemic planning is around the psychology and how do we tell our staff and our clients that they're safe, and how do we demonstrate that? One of the great things that Poppy does is, if we know we found COVID, then maybe our screening isn't working, or our physical distance isn't working, or our PPE isn't working, or our cleaning protocols. Also, if we're aware of the virus, it typically gives us, using the Poppy system, 5 to 7 days alert or heads up about a potential outbreak. And so we can get our hands around it, we can stop this thing, we can isolate people, quarantine them before the company either operationally has to close down or you have reputational issues. So it really it's just exciting. When I first saw this a couple months back, we instantly joined forces with the Poppy team, and it's been excellent. So I just wanted to tell you about that. Make sure you knew. If you want some more information, you're going to see and hear more and more about this all the time. But yeah, that's really what the whole thing is. And at the end of the day, hopefully we can keep employers compliant, employees safe, and customers confident, so they actually want to come to your workplace. All of this combines to helping reduce the risk of COVID-19. So that's really what the program is about. Our team is happy to help you. We can customize anything to meet your needs. Now, if there's any questions that anyone has, we can talk about those now.
Thank you, Scott. That was awesome. And yes, I have a ton of questions. So first, before we get into my questions, I would like to point out that I love the fact that you're talking about how using something like your daily screening tool goes to confidence. We need to have confidence that the businesses that we're visiting are safe and they're compliant. Employees need to have the confidence to go to work and know that they are safe and going to stay healthy. So that's amazing. And that's a very, very important part of using a tool like the daily screening tool. The second thing I want to comment on is I cannot get over how inexpensive it is. $20 a month for most businesses. And when you think that the average hourly wage is, somewhere between $15 and $20 an hour, if you have to dedicate someone at the front of your business to take information, the cost savings and efficiencies are tremendous. So that's amazing to me. So that leads into my first question. Is there some kind of a license, or is there a contract for this app?
That's a great question. There is not. Again, when we first started coming out with it, people weren't sure how long this was going to be around. Then they weren't sure with the vaccines coming out. Our onboarding system is so quick and so easy. It just didn't make sense for us to tie anyone down to a contract time, or so it's month to month. It's just a month to month. It's a SaaS sort of model, and it's real easy.
Oh, that's amazing, because I think the uncertainty is about the entire pandemic and how long it's going to last. is one of the biggest stressors for people right now. And knowing that they're not committing into a year-long or 2-year-long contract probably makes them feel like they have a little bit more control over what's going on. So that's an amazing feature. I love that. And so my second question, so I love my smartphone. I love to leverage it for just about everything. I'm ready to scan a QR code, but what about, I'm thinking of somebody like my mom who's just turned 80. She does not have a smartphone. She barely knows how to use a cell phone. So what happens when she goes to a business that's using this app and she doesn't know how to get connected?
Sure. No, and it's surprising. It happens to more people than you'd think. Either they don't have their phone or it's out of a charge or whatever. But it's real easy. If they're with a family, let's say they're going to a restaurant or they're going into a mall and they need to have their information recorded, and a family member has a smartphone, then they would just, the first person hits it, fills it out, their name and their phone number and email, and answers the questions, hit submit, and then they tap it again, the QR code, and then fill one out for their parent or friend or family member that didn't have the smartphone, like your mother in that case. So if the two of you had gone out for lunch somewhere and they wanted to get your information, you'd fill it out for yourself and then you'd fill it out for her. If both of you arrived without a smartphone and couldn't do that, then you would simply tell the staff person and they would do it on their phone or on their computer. So companies now are putting in this daily screening tool into the reception area, just so that the receptionist could fill it out for someone who didn't have the smartphone or didn't have that information. But the QR code generally works great. You can email it to visitors before you arrive. Please fill this out, to contractors, vendors, suppliers, whatever. And it's unlimited. So, if you have, 100 people a day, 500 people a day, fine. You can just run it through. Just think of managing all that paperwork and the time your managers would have in sorting and then preparing something to send. We're getting calls from companies every day and they've had someone phone in sick. They've got to call public health. They've got to put these names and numbers and the time frames together. And it's a lot of time.
Absolutely.
So.
Yeah, I can't imagine the efficiencies that some businesses could realize from using something like this tool. So as always, lots of questions that I have floating around in my mind. I guess one of the really key benefits of using this tool is that this is active screening, not passive screening.
Correct.
I know from my own experiences going out, that there are a lot of businesses that don't really understand the difference between active and passive. And
excellent question.
Yeah.
That's people, they hear screening and they think it's screening, and screening is screening, and it's not. So passive screening is when you approach a store, and we've all seen this in the past somewhere, you approach a store or a building or workplace and they have a list of questions posted outside. And basically it says, if you answer yes to any of these, please go home, kind of thing. Don't come into the store. Or a staff person might say to you, did you read the list? And did you answer yes to anything? No? Okay, come on in. That's called passive screening. Active screening is when the organization actually has a record of the person's first name, last name, phone number as a minimum, and then they have to answer the questions, and then they say, no, I didn't, and they record that information. So they know the date, the time, the first person's name and phone number, so they can reach out to them or public health can contact them. And that's called active screening. And that's where you actually keep a record and a file. And just as a point, we were at a restaurant one day and we saw a person record a bunch of names. And about an hour later, this was a few months ago, an hour later, one of the staff people came up, took the list of paper, stack of paper of names, tore it up and threw it in the garbage. And it's like, these are records that you will need for weeks and weeks, because if someone phones in sick, you'll need to backtrack. So just as a point, whatever system you're using, you have to keep these records, for at least a few weeks so that you could share that information with public health.
I'm really glad you clarified that, because I think you're right. I think a lot of people don't realize what their obligations are under the current law. I think we're still in a state of emergency, are we not, in the province of Ontario?
Yep.
And so
yep.
businesses are legally required to do the active screening and to have a safety plan. This is not a best practices recommendation. This is something that they're required to do. Is that correct?
Well, it follows along. So the the playbook you have to have. The active screening comes in and out with stages. As you move towards green and you're clear, you don't need to be doing that. You can go to passive screening. We can see some of the areas where malls now, if a person's going into a mall, they have to be actively screened. But not all jurisdictions, not all regions or counties have that. It just depends on what's happening locally. But that's the scale. And if you know that you're in a business where you have to track it, then you don't want to pay a lot of money. You want to have something that's super simple, and the administration is really the key. That there's no spelling mistakes and things like that. There's no people's time and effort sorting all the paperwork and everything. And it's cleaner. It's a safer, it's a no touch system, right? So yeah, that's the big advantage. But no, I think that active and passive screening changes certainly as the outbreak changes across the region.
And absolutely a best practice, no question whatsoever.
Yeah, it is.
Yeah. So
we have companies all across Canada and stuff using it in Europe and stuff, but in Ontario in particular, we're finding through a lot of our partners with the various boards of trade and with the Chamber of Commerce, people are contacting us every day. So,
and I'm not surprised. I think this fills a void of tools that businesses need to stay open, and we all want our businesses to stay open. I'm going to change topics again a little bit. I heard you say that you can customize the app. Can you tell me about that?
Yes, we can put in, if you have multiple sites or departments, we can add that so that an employee or a customer could say, I'm at this site or that site. They can pick from a drop down which one it is or which department you're in. Are you in the warehouse? Are you in HR or finance or productions or whatever area that you're in? That can be customized. It can be done with schools and universities and municipalities, which buildings and so on. We can also ask different questions if we wanted to. So if for example, we've had some groups where they've wanted to record the visitor's license, car license, license plate number, if that was important. And so we were able to add that note in. And again, it just makes it a lot easier for their own security and facilities people to track who's where and which vehicles and so on. And so we can do, a fair bit of customization. We can make it emails sent to certain people within your organization when people fill out the form, or just a negative if they get if they answer the questions and they're not allowed to enter, then that can be sent to certain managers as well. So there's a fair bit of customization depending on what organizations need or want.
Wow, that's amazing. I had no idea. I thought you were going to tell me that you could put their logos on it or something to make it look branded, but
well, we can put their logos on it as well.
But having said that, what you're talking about is so much more important to business owners, especially, if you have a head office and you have satellite locations or branches.
Exactly.
Or a manufacturing plant or something like that. That's just amazing to me. Because if there's an outbreak, let's say you're a manufacturer and you have a corporate head office, and then you have a site where your products are actually being assembled and produced, and there's a problem at the plant, it doesn't necessarily mean there's a problem at the corporate head office either. So you can keep things nice and clean, and
you can filter by that location and send only that information to public health if you had an outbreak or a person testing positive. The other thing, and just to mention this, is we do update the app or the content in the app based on the signs and symptoms of someone being affected or impacted by COVID. So if you remember this yourself probably, over the last year, there's been a number of new changes to the signs and symptoms. Headaches, that's a new thing. It wasn't something that was originally out. The loss of smell and taste and the sense of smell and so on, that kind of thing. So those are things that we've added. As time goes on, if there's different changes or the variants, or maybe people would have some sort of rash or or whatever, then we can add those. So it's very updatable, and we push those changes. So as the government and public health change those guidelines or those questions, we update the app seamlessly.
Oh, that's amazing, because the changes have come quickly and often.
Sometimes.
And so knowing that it's always being updated and looked after is, I think, a very, very important feature. And I would find that appealing if I was looking for a tool like this. I have kind of a couple quick other questions before we let you guys go, because I know that you guys are incredibly busy these days. So you were talking about training for the staff. Can you talk about that a little bit more? That was intriguing.
So with the tool the way it is, it includes the training for all the managers that are onboarded into the system. So all the management get training. We have an online 30-minute program that staff can take, and I think it's an additional $9, $9.99 per person. You know, so if you had 20, 50 staff or whatever, they could be signed up and registered. They do the training online. They get a certificate, so that if the insurance companies want to know, or WSIB, have people been trained in infection prevention control, you know, you can say yes, and each employee can have their own certificate. But people love it because they just don't have a background in public health. They don't even, it's, you know, talking to a lot of people, they'll phone up and VPs and owners of different companies, have we got this right? You know, and they just, because they don't have the medical background, they don't know if they have it right. And so taking this training really helps to, you know, set the terminology right and really break it down to what they need to do. So it's been really well received.
Yeah, I bet.
And it's quick. It's 30 minutes, right?
And I think your point is very well taken, that organizations like the WSIB and your insurance companies are going to be very appreciative of companies that are being compliant. And, you know,
well,
maybe
COVID is now a reportable illness under the WSIB, like a reportable accident. It's an illness, workplace illness. And the premiums for WSIB are based on claims experience. And so if you do have an outbreak, or if you do have staff that get sick, then your claims experience is going to go up and your rates will go up. If you can keep those numbers down, or prevent them from happening, or a larger outbreak from happening, certainly you're going to reduce your numbers, your claims experience is going to go down, and your costs are going to go down. So there is, you know, a return on investment. There is a financial impact and protocol, and, you know, it's relevant to your business for sure.
No, I did not know that. So I'm really glad that you brought that up, that there could be WSIB implications if you have a COVID outbreak. So that was a very good point. Thank you. And I kind of have one final question for you, if I can just indulge my curiosity about Poppy. So what kind of business are adopting Poppy? Who is it really made for? Who gets the most amount of benefit out of it? To me, it looks totally fascinating. We may have to do another lunch and learn just on Poppy later, but can you give me a little bit more info about Poppy?
Yeah, the Poppy. So when we breathe, and you've heard this, you know, there's bacteria and there's virus in the air. If I take my hands and clap them together, you know, I might have had, you know, small particles on my skin. If I clap them, they become airborne again. The notion that COVID is a purely droplet is not true. It is some airborne. There can be very small particles. If I were to breathe or cough, how far might that travel in the air? So with Poppy, these basically it's about the size of a smoke detector. There's a fan in there, and it's filtering the air through that environment space, depending if you're in a lobby or workplace or store or whatever, warehouse. And it's filtering the air, and then that any particulate, whether it's dust or mold or bacteria or virus, is captured on a filter. And they have a lab system that evaluates up to 3,000 different pathogens that might be in the environment. So it can tell you today if there was COVID in the air yesterday or on a surface. And then you can start to take action. Maybe we had a training room, maybe a number of people came in, you know, and now we've found COVID in that space. Anyone who's in that space needs to be contacted. Anything in that space needs to be deep cleaned, as we call it, or more thoroughly cleaned than the sort of traditional routine or daily cleaning. So we make sure that that area is clean. We make sure that we contact these people. And we know that there was COVID. We wouldn't have known otherwise for maybe 4, 5, 6, 7 days until that person starts to become symptomatic. And, you know, again, we all know that asymptomatic shedder, the person who's sick, but they have no signs and symptoms, and they feel fine. They come to work, they're fine. And yet they're shedding virus. You know, one of their taglines with Poppy is, we make the invisible visible. So how do we know that our cleaning worked? How do we know that our social physical distancing, our masking is working? We don't really know. Now with Poppy, we know. And so we're seeing organizations quickly and rapidly are signing up to be able to, one, provide a safer place, but to demonstrate to their staff and their customers that they have a monitored space and they know that it's protected or safe. Or if it's not, they can isolate people and take immediate actions to help make that environment safe. So it's a game changer. It's a big, significant introduction, and I think you'll certainly hear more and more about Poppy as time goes on.
I agree. I think that number one, it's a fascinating organization. And number two, I think, or I hope, that moving forward, we've learned so many lessons from the COVID-19 pandemic that more and more businesses are going to want to be pandemic ready at any given time. Because we don't know when that next virus is going to come. We don't know when it's going to hit us, how bad it's going to be. And I just think
hearing that from almost every one of our clients, every one of the presentations, conversations we get into, we're hearing that. Certainly everyone's heard about the different variants and what the impact of those are to people, to age groups, on the vaccines that are being pushed out now and so on. So it's you know, I don't think this is something that's going to go away quickly, and I don't think there is a silver bullet. The more, there's not one vaccine or one thing that's going to, you know, stop this. The more pieces you have, the more layers of Swiss cheese or spokes on a wheel, the stronger, you know, you have a system. And, you know, just because you have Poppy doesn't mean you don't need masks. And if you have masks, you still need physical distancing, and you still need cleaning, and you still need tracking and daily screening, and all of these things all make to build a stronger, safer environment for everyone, you know, concerned, right?
Yeah, absolutely amazing. It makes me feel more hopeful, you know, for the future, knowing that
it is. Yeah.
The world is starting to pay attention to ways we'll never be able to prevent them completely, but we can manage the next pandemic much, much better with tools like this.
Lynn, that's the perfect word, and it is manageable. We've done programs with other companies like IQ Offices, for example, and I mention them because they have a lot of information on their website for other organizations to stop in and look at and see what they've done. But we've worked with them right from day one back in April, and it's achievable. You know, people go, oh my God, there's so much to do. Well, there is, but there really isn't. It's manageable, it's achievable. We can give you a little bit of direction and off you go. And I think it's very achievable. And we've seen a lot of people have been relieved and it's like, wow, this is great. And their employees like it, you know, and that's how you get your business back to work and stay open and, you know, make money and keep the economy going and all these things, right? So.
Absolutely. That's just the perfect sentiment to end on today. The whole point of this, why the Ottawa Board of Trade is standing behind the daily screening app, we want you to stay open. We want you to be safe. We want people to have confidence in doing business with you. And this is one of the tools that you can use in order to make that happen. So Scott, thank you so much. As always, a huge pleasure to chat with you. There is a link posted in the chat for you to sign up to get the tool for your business, or you can reach out to me at any time for more information and I will happily pass it along to you. So thank you very much, everybody. Have a wonderful
Thank you,
afternoon
Lynn.
and stay safe and be COVID wise at all times. Thanks,
Well,
everybody.
thanks, Lynn, and thanks everybody else.
Thank you.
Take care. Have a great day.